this quick lesson, we're going to learn about the McKesson Doppler carried on our frontline medic units. These Dopplers are used to detect pulses during CPR, in a patient's extremities, or to auscultate a blood pressure if our patient has a left ventricular assist device or LVAD. These are very simple units that have a volume slider on the left and a power button on the front. These can be cleaned and decontaminated using the wipes that we already carry on our units. Please do not submerge these in liquids. Now, before we really get into it, let's talk about what we don't use a Doppler for. We don't check fetal heart tones. This is something we're really not trained well to do. And if you do it wrong, you're not going to help the mom or yourself. You're going to freak mom out a lot. And we don't get a lot of usable data from it out in the field. So please, 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 do not use a Doppler for fetal heart tones. To use these, we're going to start by turning them on and adjusting the volume. Give yourself a good-sized dollop of gel on top of the sensor head before you start. When you're auscultating a pulse, you can use it either perpendicular or parallel to the vessel that you're trying to listen to. So you can see here that we're taking a reading at the radial pulse. We're going to use the same landmark we would if we were palpating this with our fingers. And this goes for any pulse point. When you're auscultating the pulse, don't press too hard so the probe is coming in contact with the skin. Let it kind of float on top of that gel. That's how you're going to get the best sound. These units are also equipped with a digital readout. That'll show you the pulse rate. Let's talk about the Doppler's use in CPR. We can quickly acquire a patient's femoral pulse during compressions as well as during our pulse checks. This is going to be located between the patient's genitals and the outside of their leg in an area called the femoral triangle, as you can see here in this image. This is really nice for acquiring quick pulse checks, and it allows kind of everybody to hear what's going on since you can hear it across the little speaker built into the Doppler. I've also found this useful in our cardiac arrest patients where we see PEA on our monitor. If we want to kind of do a final check to make sure that we're not in a state of pseudo-PEA where the person's heart is beating but not producing a very strong blood pressure, we can Doppler the carotid artery to get secondary confirmation. This can also be useful with patients that have injuries to the extremity and we're worried about the circulatory status of that particular extremity. These distal Doppler readings can be really helpful to determine if the patient actually has blood flow to that limb in an otherwise difficult to find palpable pulse. And lastly, let's talk about left ventricular assist devices. LVADs are surgically implanted mechanical pumps that takes over the work of the left ventricle in case a person has significant heart failure. This can be used to either bridge until the heart can be repaired, or this can be used to bridge to maybe a heart transplant once a donor organ is available. Because it's a mechanical pump, it doesn't produce diastolic and a systolic blood pressure. It doesn't give you two different numbers. And our monitor isn't likely to get a blood pressure on these patients. To get a blood pressure on an LVAD patient, first put the blood pressure cuff on the arm you want to take the reading and put it on right, not backwards like this guy. Now place a Doppler probe on either the brachial or the radial artery. Try listening for the pulse first before you inflate the cuff. It's going to make things a heck of a lot easier for you. Now go ahead and inflate the cuff and listen on the way down. The first audible noise you hear is going to be the reading, which is going to be your MAP, or mean arterial pressure. That's what you're going to get. You're not going to get a diastolic and a systolic blood pressure. This is what you'll note in your chart.